Hi, Dr. Kathleen Young, board certified child, adolescent, and adult psychiatrist. And today, in the short, I want to talk to you about repetitive behaviors in autism spectrum disorder or neurodivergence, and specifically in sort of these less obvious presentations of autism, because that is where my particular interest is. And I think that some people have a hard time sort of differentiating between compulsions in OCD and repetitive behaviors in autism. And I think the kind of quick and dirty way I think about it is that repetitive behaviors in autism usually serve a purpose. And a lot of the times, the purpose is to regulate their nervous system, or it can be soothing or enjoyable. And compulsions in OCD tend to be a behavior that is done because of an obsessive thought, like hand washing or checking. They have some thought that they left the stove on, and so they check, or stuff like that. Tends to be more linked to an obsessive thought. And since we're on the subject of less obvious presentations of autism, some of the repetitive behaviors that may be less obvious, because usually when people think about autism and the repetitive behaviors, they think about hand flapping or other kinds of stimming. Stimming is a repetitive behavior that's used to regulate the nervous system. So a lot of times we think about head banging or hand flapping when the intensity of the emotion, whether it's excitement or anxiety or overwhelm, gets high, and then the person with autism does something to bring it back down and regulate themselves. But other kinds of stimming or repetitive behaviors could just be like twirling your hair or shaking your leg. I had someone recently tell me that they shake their leg as a way to regulate. Other kinds of repetitive behaviors are skin picking and hair pulling, and not all hair pulling is autism, but these are just some examples. Plucking of hair, so plucking with a tweezer on your legs or your arms or your face. Biting, chewing, biting your nails and your hands and your cuticles. These are all things that are seen as repetitive behaviors. Not all of them are seen in autism. They are things we see in autism. Not everybody who does them has autism, I guess is what I'm saying. But things to think about when you see them in people, especially as we're thinking about less obvious presentations of autism.